right, we're gonna close. Does this work? Yeah, you guys can hear me? Okay. Once again, whoever is in this room is the most courageous of the day. You could see how numbers go down throughout the day. So good for you and good for us. Thank you for being with us. As always, I like to take a trip through the day that we spent together. So this morning, we actually started talking about the future of trauma healing with 4 experts from around the world. Gabrielle is still with us, and spoke about what can we learn. Oh, Gerard is also with us. There you go. So a few people. What can we learn from other countries, from the US, from Rwanda, who just went through, as you guys know, is recovering from genocide. And even though we're all, different, we could still learn from one another. And I love the idea of reclaiming the word resilience. That's exactly how I feel. I don't like adding more words because it just creates confusion, so I'm with it. I did want to share a story because Thomas spoke about maybe replacing the word resilience with fluidity. And I wanted to tell you that I heard Stefan Truvanov, the hostage that came home. And when people asked him, what did you have to learn when you were in the Chevy? He said, all my life, I was like a rock, like a stone. Like I was running and crushing everything on my way. I could do whatever I wanted. I knew that if I wanted something, I would go and do it. And it says, and as soon as you arrive and you understand, you have zero control. You have zero control. You have to beg to go to the bathroom. You have to beg to eat. You have zero control. Said, I realized I need to become water. And he came up with that analogy on his own, right? He said, I have to become water because I have to take things as they come, just fit in. And that's how I decided to survive. And I thought it was, such a beautiful thing that he shared. Then we heard from the tribe of Nova, who told us about the Talich Shikum and especially the role of the community. I was extremely, surprised by the number that they mentioned, around the 40 different communities that are getting together, right? So it's 40 sub-communities of parents that are, mourning someone they lost, or parents of survivors that are discussing, how their kids are getting better, or, other groups. And there are 40 different, affinity groups, if you want to call them, that are working on this. Then we spoke about building Israel's national research agenda, which I know created a lot of discussions afterwards. There's always this discussion around, should you collaborate on research, but then you risk, infecting one another with your ideas, or should you not collaborate because it's then, or should you collaborate? Is it good or bad? Like, are you going to infect everybody with your ideas and then there'll be less ideas, right? Or do you share the data and do better together? And, you guys know I believe in collaboration. So maybe I'm biased, but when I look at what we've done really well, where we've done best in terms of innovation in the last 20, 30 years, I also think about cancer, where we had the same issue where money was so fragmented. Labs were getting 1 million here, 1 million here, 1 million here, and nobody ended up coming up with anything. And then they decided to bring the money in the same research institute, and that's when a lot of things were discovered. And same with HIV. We had reached a plateau, and then 4 pharma companies decided to do a JV, put all of their data together. It was called VIV. And then we had more drugs, and and now HIV is also a good example in my mind for something that I don't think the stigma is completely gone. I think if you tell someone has AIDS, they're still going to think, who did he sleep with? Doesn't he know better? But awareness is so high, and there are good solutions. So awareness is a little bit compensating for what stigma still exists. And I think that if in mental health we get there, I don't know if we'll be completely without stigma, but I think if awareness gets so high that everybody in Israel knows what number to call and where to go, then it might compensate for the stigma. And then we had 2 sessions, one on innovation and then the impact showcase. So on innovation, I went around, but I was mostly in the piece of comorbidities, where we spoke a lot about what is happening besides for PTSD. Everybody's talking about PTSD, but we know that there are other things happening, like addiction, like eating disorders, that are not getting as much attention, but are really consequences of the trauma, and we can't ignore it. I heard great things about tech and AI and nature. I don't know if anyone wants to share what they took away from it. And then on the last one, we had the Impact Showcase, where you got to learn about great partnerships. And again, the goal was really to hear about those partnerships, celebrate them, and then get ideas about what partnerships can do and how we can create more. And so we want to end, first by hearing from you guys, if you have anything you want to share after those 2 days, things that stayed with you, things that surprised you, but not only in the negative side, right? There are some things we heard that was disturbing, but what are the good things, the cool things that you heard in the Impact Showcase that are really going to stay with you on the positive side? And then I do want to reward one of the Impact Showcase presenters in each room. So, any questions or comments from the room?
יש מיקרופון נייד. שאלות. כן.
Giving impression, correct? Giving my impressions.
Yeah.
So
what stayed with you?
I was expecting to meet, but many conferences you meet with people, and it's very superficial. And everybody comes, they speak to you, you speak with them. They are not listening to what you say. They want to tell them what they want to say. I have found here a different ambience. I think here, people, we were learning from one each other. I have learned a lot today. So I think some people have learned a little bit about what I do. But the networking, more than even the conference, the networking was phenomenal. I was telling a friend, if 10% of the contact I had is realized or follow up, that's already a dream. So I want to thank you, because it's not just the organization, but it's the quality. It's a special place. And I think we can feel the vibe, and we can feel the energy of the people who all want to help. And I want to thank you for that.
אם אתה יכול להגיד פנומנל עוד פעם, בבקשה.
I'd like to give my answer in the context of the past 2 ICAR summits. I remember last year coming to the event and thinking, being really impressed by the energy and the values that were established at the event. And I wasn't sure what to expect this time around, but I found similar energy, but it was much more channeled into focus and action in a way that was really inspiring. That's my main takeaway.
We still have a lot to do on action,
First, I'd like to convey my appreciation on this conference. As an entrepreneur, I go to many meetups, many entrepreneurs for networking. This is one of the best. And it's because it's organized and the quality of the people. I want to raise something about what was spoken several times in the meetings here, is funding and the lack of funding for innovation, for programs. And I, as a startup, I get funding from the Israel Innovation Authority. And they, surprisingly, are not connected to the government. They are an authority by itself. So they have their 1.5 billion shekels a year that stays. and they after October 7, it was added another 400 million shekels a year because they believed that to go out of this 2 years of crisis is innovation and new companies. The same thing for mental health. I think that there's money out there, but there are not specific programs out there. So if talking to the government, Israel Innovation Authority, Misrad HaKalkala and others, specifically for mental health, there's one small program and that's it. Thank you.
ביקשנו שיגבירו את המזגן טיפה, אנחנו יודעים, זה בטיפול.
תודה. אז שני דברים. אחד, אני חושב שבכנס כזה להגיש או להזמין לאיזה שהם רעיונות, זה ה-easy part. אני חושב שליצור שדה של חוויית שותפות, זה יותר קשה. זה דורש את זה שאתם תחיו את זה ככה, ואני חושב שהחוויה הזאת עוברת בצורה מאוד אותנטית, כאילו יש תחושה שמשהו טוב קורה במפגש ביניכם, שאליו אתם מזמינים את המעגל, אז הבית הזה, זה מרגיש, זה קצת מפתיע, כי כל פעם מחדש, כי יש כזה מין מחשבה שאתה מגיע למין מרחב כזה של, מין exchanging כזה של perspectives, כן? אבל אני חושב שקורה פה משהו יותר עמוק, ותודה רבה על ה-embodiment של הקונספט הזה, זה אחד. שתיים, דבר שבהקשר הזה לי היה קצת חסר מבחינת החומרים המשותפים, יש הרבה מקום לאנרגיה גבוהה של הצלחה ואני חושב שאנחנו חולקים גם הרבה חוסר אונים. לי באופן אישי היה קצת חסר להרגיש את השותפות גם בזה. כן, כי אנחנו כאילו מביאים הרבה אופטימיות אל מרחב שבו אין לנו פתרון עבורו. אנחנו עושים הכי טוב שאנחנו יכולים, אבל אין לנו פתרון עבורו, ואיכשהו מרגיש לי זה משמעותי להנכיח את זה, כן? שזה עוד משהו שאנחנו חולקים. מרגיש שהמרחב שיצרתם יכול לאפשר גם את זה. תודה.
אני גם רוצה להודות על הכנס המדהים הזה, פעם ראשונה שאני כאן, ובאמת גם ההזדמנות לדבר, אבל גם הזדמנות לשמוע, ובאמת אני משתתף בכל מה שנאמר עד עכשיו. אני רוצה רק, השאלה שלי זה, אוקיי, יש לנו את הפסגה הזאת, וזה באמת הרגשה של פסגה, אבל חוץ psycho-education, הפרויקט הזה, השאלה, מה קורה מהפסגה הזאת? כאילו, איפה אנחנו לוקחים את זה הלאה? האם נוצרו פה קבוצות עבודה, שיתופי פעולה, עם נציגי הממשלה, לדברים ספציפיים, לכיוונים ספציפיים? יש פה המון, זאת אומרת, לקחת את הסאמט בהזדמנות לעשות גם פגישות עבודה, שכולם כבר פה, וליצור מחויבות להמשך העבודה המשותפת, כי יש פה המון אנשים מדהימים, אבל זה לא רק לחבר בכנס, אלא לחבר למחויבות להמשך עבודה בקבוצות עבודה. זה ההצעה שלי, כי השאלה מה בעתיד ואיך אנחנו הופכים את זה לאסטרטגיה ואסטרטגיה לאומית. תודה רבה.
תודה. קודם כל באמת נהניתי להיות פה ולפגוש המון אנשים וגם המון חברים. יש דבר אחד, מהטבע שלי אני enfant terrible, אז אני כן רוצה בעצם... מה?
אין דאץ'.
אבל דבר אחד בכנס על טראומה, חסר לי, וזה הטראומה, הטרור שיש בתוך משפחות, המקום של נשים שעוברות פגיעות מיניות. אלה הטראומות הכי נפוצות והכי הרבה פוסט-טראומה, וזה פשוט לא היה מקום. אז אני מאוד מקווה שהפורום הזה יכול להיות גם פורום לחשוב על הבעיה הלאומית והבינלאומית שקיימת. אבל תודה רבה.
I just want to, I think, echo what I said this morning. And beyond the conference, I think you've created something much bigger than that. I think you've created a community. You know, you have mapped what is going on in Israel. And I think what I saw when I came here over the last 2 days was exactly that, was what we have here in Israel. And because we have this community, what you've really done is given us a place to see who is doing what. And my whole experience of the last 2 days has been incredible, because people will offer to connect people. People will offer to help. People will want to sort of collaborate across different organizations, whether it's government, whether it's NGOs, whether it's private, whether it's research. So I think you've created something much bigger here, and it's been an absolute pleasure to be part of it. So thank you so much.
All right, thank you all. I'm not going to answer one by one, but we're taking notes of all of your ideas, and maybe I will address, Yakir, your question around what else? What are we doing? Because I do think we're not great at telling people what we're doing. Yesterday we gave you a taste of what we've done, but you know, what's the plan forward? So obviously we need to continue psychoeducation, but way beyond, you know, TV. And to me, the TV was really a way to get out and make noise, because this is something, you know, 42% of Israelis still watch TV for some reason. And so especially 1 minute before 6 and 1 minute before 8. And so we said, you know, we need to go out there and do this, but also it was so that we could recruit more collaboration. You know, it was really also strategically because we wanted more people to join the bandwagon. I would have loved to be able to do this at the same time as, you know, ads on the bus stops and ad in the buses and all of that, but it was just not possible to master everyone together. And I think now with the first step that we've done with TV, it's going to be easier to bring more people with us. But, you know, TV campaigns on their own don't do much. We need to now take those messages and get them down into the community through the schools, through the Shilton HaMekomi, the municipalities, through all kinds of programs. And so we need partners to do that. We're not in the field. We need the people that are in the field to do that. The second thing we mentioned briefly was the soldiers' work that we've done. And what came out of this is actually an understanding that we have a lot of different pieces that could create a continuum of care for reservists, but they're not connected, right? It's, again, that bridge. Like, there are a lot of pieces of the bridge, and we need to find a way to connect them. But that will take work on the side of change management, convincing people to work with one another, and that they're not giving up on what they're doing if they join a project like this. It's going to take funding, so we're discussing now with funders who wants to help build this. And we are...
נראה לי בלי סאונד, זה סך הכל אוקיי.
Okay. I was hijacked. And we're trying to, you know, build a tochnit, right? Like a program to do this, write a blueprint, see what it could do, etc., and then, you know, build it with the partners. And we think, like, if you start with reservists and then you talk about their family members, because one cannot go without the other, then you're actually piloting a Retzev Tipuli, a continuum of care for civilians, because at the end of the day, their wives are civilians, right? Or their husbands. And so that's one of the things we're doing. And we also heard a lot from the field that teenagers are really, really suffering. COVID-19 straight into the war. In the north, 30% of teenagers don't go to school anymore. And we heard a lot, also, I don't know who heard today, and when Amir from Ruth was talking, and I heard the same from Uri Yatzkar at Ziv. We see cases of teenagers that come to the ER or to clinic with such advanced states of eating disorders, or after a suicide attempt, when we didn't know they were at risk. Right? It never happened before in Israel. We were really good at identifying kids that were at risk. But right now, because the kids don't really go to school, the friends don't see them, the parents and the teachers have their own shit going on, right? So the kids are really transparent. And I love the quote from Winnicott where he says, it's such a privilege to be hidden, but it's such a disaster not to be found, right? And I think the teenagers today, that's exactly what's happening. So we want to start the same process that we've done about reservists on teenagers specifically. We know it's going to be even harder because education is a field that's been established for many years. There are a lot of players, and so we'll see how we do it. But that's one of the programs. And am I forgetting anything big? Those are. Yeah, we just published a big paper on Arab Israelis and where they are complete deserts in the field. So it was actually a very deep research of actually looking on websites and trying to figure out who says they have services available, but then actually calling them and saying, hey, we have a patient here that needs to see someone. And so comparing the theory versus the practice. And we have identified 71 municipalities or areas with zero access to care. And so now we're starting another roundtable to work on specifically access to care for Arab Israelis and what needs to happen. And again, like with the reservists, they decided to work on the Retzef Tipuli, on the continuum of care. With the teenagers, it might be something completely different. And with the Arab Israeli, it might be something completely different. We'll figure it out as we go with the group, because we use a process of really listening and analyzing and then, aligning on a problem statement that we think we can go after. Yeah. And then you heard about the research program that we're trying to do, so we'll continue to work on that. I won't spend too much time on it. And the workforce capacity, we didn't speak more. We spoke about it yesterday a little bit, but we're trying to map who is trauma trained actually in Israel, because there is, no one knows. Right? I mean, today Eyal was talking about we don't even know how many psychiatrists are specialized in children, but we're spending so much money in training people in trauma, whether it's EMDR or PE or whatever, but we actually don't know how many we have and how many we need, and do we have too much EMDR and not enough PE? We're working a little bit blind. So we wanted to start somewhere on the workforce capacity issue.
אני רוצה להתייחס לשתי נקודות, ברשותכם. מר ברום, לשאלתך, רק נגיד לגבי נושא של אלימות במשפחה ופעילות של נשים, אני מייצג, גם אני מנהל את תוכניות ההגנה של פורום מיכל סלע, אנחנו עובדים עם רונית לב-ארי, נפגשנו איתם, אנחנו מכניסים ודואגים לחבר ביניהם לבין הקואליציה, לוודא שבתוכניות הכשרה של מטפלים היום יש גם שיח על הנושא של אלימות במשפחה, ולא מצבים שקורים שזיהינו מהם, שמתייחסים לפעמים לאלימות במשפחה כאפקט של טראומה, ולפעמים יש הכלה, כי הוא חזר מעזה, זה בסדר שהוא שחרר איזה סתירה. זה קורה, זה באמת קורה, ולכן אנחנו בהחלט מתייחסים לזה, ניסינו שהפורום יהיה פה, לא הסתייע. ונקודה נוספת, כן, יש גם הרבה דברים לא טובים, שאנחנו כעמותה, כארגון, סליחה, אנחנו רציתי להגיד שיש בהחלט גם המון דברים לא טובים שאנחנו שומעים. אנחנו מדברים עם עשרות ומאות ארגונים ועמותות, אנחנו מקבלים גם את הצד הלא טוב. לא תמיד המדינה, לא תמיד העמותות, לא תמיד התורמים, לא תמיד החיילים, זאת אומרת, יש המון דברים לא טובים, אנחנו גם מקבלים את זה, אנחנו רושמים את זה, וזה רחוק מלהיות ארגון שמציין רק ניצחונות, אבל בהחלט יש לזה מקום, וטוב שאתה אומר את זה, ואנחנו נשמח לקבל את זה ולשמוע את זה, וזה גם עובר הלאה. אנחנו מציגים בדוחות שלנו בעיקר את הדברים הלא טובים. זאת אומרת, או לא בעיקר.
I have to tell you, I got the opposite feedback yesterday from someone. That we were too negative and not enough positive, so I don't know.
אז תודה רבה שהעליתם את זה.
So now, for the end of our impact showcase, I want to call on the people that have gotten votes and appreciation from the team and from their moderators. So the first room was about digital infrastructure and system backbones. So we looked at different digital platforms that were set up. You could call them like back office sometimes, right? It's things that are helping to build the infrastructure either of municipalities. The kibbutz movement was here. And iMinder spoke to us about how they're working with the army. And the presentation that got the most recognition was Bishvilenu and Kfar Ma'avar. So you guys, thank you. Now you have to decide who keeps it.
עכשיו נראה אותך. זה לא היה מתוכנן באמת.
The second room was around new clinical and digital treatment models. So people were talking about partnerships that allow us to discover new therapeutic tools or digital interventions, like generate more evidence, etc. And I'm trying to see if the winner is here. All right, let's see. I didn't see. The winners are Alut and Relax Elf. No? Ron is not here. Sophie, you'll take it for them? Okay, go for it. Here. Here, Hagan. The third room was about community and municipal capacity building. So really collaborations that help strengthen municipalities' frontline roles and community systems. And Dr. Asala Halaj from University of Haifa, who's working with the municipality of Al Fam, Al Fachem, sorry. And Toda Lach, Toda Shligar. Okay, next. And then for the last one, it was about workforce peer models, experiential models. So how can we support, how can we expand the mental health workforce to include more people and more responses? And the winners are IMFA and War for Soul. Are they here? Is Razi here? Shauli? Man, we should remove their... They lost it. All right, thank you, Maya. Apple. He's gonna get it. He's gonna get it. Israeli style, exactly. All right. Well, my turn to say thank you to all of you, because this would not be possible without all of you here. So we're very grateful for your generosity in how much you're giving us and how much time you're dedicating to mental health and to well-being and the whole spectrum. And I'm very humbled to be in this room, because I think so many of you have life experience and expertise that we will never get close to, but you're sharing it with us. So thank you so much.